The hidden neck injury after a car crash, why x-rays and MRIs often miss it. Right now you've done everything you're supposed to do. You had an x-ray, an MRI, therapy, even medications, but you have neck pain, pain going down your arms, headaches, probably back pain, and everything still hurts. Here's what no one else is telling you. These standard tests completely miss one of the most common causes of chronic pain and disability after an accident. They often miss hidden ligament damage. In this video, I'm going to show you the revolutionary test we use to detect this injury with pinpoint accuracy so you can finally get the right treatment and fix the pain for good. I'm Dr. Gregory Kramer. I have over 30 years of clinical experience and I'm certified in structural rehab by Chiropractic Biophysics. I specialize in treating chronic spinal problems, chronic neuropathy, chronic knee pain, chronic disc problems. Also, I deal with traumatic spinal ligament injuries, often from old automobile accidents. So, if you have any of those problems, really watch this video. This could be a game changer for many of you that are suffering with chronic pain. Now, how do I help people? Really simple. Number one, we analyze your spine using static and motion x-rays. We find the exact cause of why you're suffering. We use corrective care principles. That's mirror image exercise, mirror image adjustment, mirror image traction. If you have a compressed disc or a compressed nerve, like in neuropathy where you have pain in your feet, we use non-surgical spinal decompression to decompress the disc and nerve so back pain, neck pain, arm pain, leg pain, and even foot pain can heal and repair. Now, before I continue with this video, I need you to hit that subscribe button if you want to learn how to relieve pain, avoid surgery, stabilize your spine so you can live stronger longer. And I mean that, live stronger longer. I typically upload a new video every week. So we're going to talk about why you're still suffering. We're going to talk about hidden ligament injuries that are often missed, leading to chronic pain and disability. I am part of a Smart Injury Doctor program, okay? So not only am I certified in Chiropractic Biophysics, which is the #1 structural rehab certification program in the world, also I'm part of a group of doctors that specialize in traumatic spinal ligament injuries. So they're experts in diagnosing, treating, and managing. So Smart Injury Doctor. So if you have questions on this video, finding a doctor near you that understands the nature of traumatic ligament injuries, look up Smart Injury Doctors in your area. Very simple. We're throughout the United States and we deal with ligament injuries, traumatic, disc, and non-disc. Okay? So very simple. When you have a trauma, whether it's a sports or work or an automobile crash, really only 3 things can happen to the spine. We're not talking about a closed head injury. We're not talking about a brain injury. We're not talking about a lacerated kidney. We're talking about spinal problems, okay? There's really only 3 things that can happen, all right? Either you have a fracture, you have a disc problem, you have a ligament or support ligament problem, or you have a little of both, okay? Now look at this picture here. This is what happens when vertebrae move too much, slide back and forth. And this picture here is angulation. It's when vertebrae bend too much. Now, real simple, we're talking about the bone and ligaments. So we're talking about these red ligaments. The red ligaments are the support ligaments. This blue is the disc. The disc is a shock absorber between 2 bones. Now, very simple. What happens when you have an injury? Well, most of the time, you are injuring these ligaments here. See how this vertebrae shifted back? That is a sprain, just like a sprained ankle or a sprained knee. It's a partial tearing of the ligament. And when that happens, ligaments hold you in alignment. You get excessive motion. Now, some of you might be old enough to know certain quarterbacks like Joe Namath, where they keep injuring their knee to eventually the knee is so sloppy you can't stand. Well, that can happen to your spine. So excessive motion leads to something called an instability. So the most common cause of pain and suffering is this ligament damage, all right? And very simple, how do we know that? That's from a stress x-ray, all right? That's an x-ray while you bend and move, and we'll talk about that a little bit later. The next thing that can happen, maybe 25 to 33%, is a disc herniation. How do we diagnose that? That's an MRI. All right, we've talked about that a little bit in my previous videos on L4, L5 disc problems. And then you can have a fracture, okay, and that's a little bit less rare. Or you can have all the above. So very simple, only three things happen: fracture, disc injury, or a support ligament injury, or all the above, okay? So how do you find out if you have a fracture? X-ray and CAT scan. So this is how we find, this is what should be done anytime you have a serious trauma. And it doesn't matter if it's work, sports, or a car accident. So let's talk about, very simple, the red ligament. These are support ligaments. And the blue is the disc. And what do you see here more? Do you see more red or more blue? You see more red because there are more ligaments, far more spinal support ligaments to damage than there are discs. You can have severe damage to the support ligaments without a disc. So this is what we're looking at. Now this is a picture of the upper neck. We're talking the upper two vertebrae in the neck. And interesting enough, there is no disc between your skull and the first vertebrae. So when you have an MRI of the neck, it starts at C1, it starts at C2, C3. So from C1 to C2, there's not a disc. So I want to be very clear. C1 to C2, no disc. So the MRI often misses that. So there are hundreds of microligaments, and two things can happen when you injure those ligaments. Either you have excessive shifting of the vertebrae forward and back. That's called translation. Or you have too much angulation. All right, remember, ligaments hold you in alignment. And when you injure them, you lose your alignment. And what happens is you have excessive motion, and there's degrees of it. There's mild, there's moderate, and there's severe. This is the disc that absorbs shock, and very commonly we diagnose that with an MRI. So, three types of injury. Each of these injuries have different symptoms. And very simple, the support ligament injury is the far worst. This is a fracture, this picture. This is excessive motion injuring the support ligaments, and this would be a disc injury. Or you can have all the above. You're allowed to have more than one problem. And so really, what are the symptoms of a disc? Well, typically, it's generally two. If you went to, very simply, looked up what are the symptoms of a disc under Medscape, it's going to be axial pain, which is right along the center of the spine. Or you're going to have radicular pain going down your arms or legs. That's the most common symptoms you'll have, either axial pain or radicular pain. Now, what are the symptoms of a support ligament injury? So again, if you went to Medscape, you can have all of these. You could have visual problems, balance problems. You could have pain going down your arm, headaches, ringing in the ears, migraines, dizziness, post-concussion syndrome. So you can have a lot more symptoms than just for a disc. So it's really simple. If you have more than pain down the middle of your back, more than pain going down arms and legs, you probably have more than a disc. So you need more than an MRI to diagnose it. So spinal support ligaments, when you injure them, destabilize the spine. So an injury can happen anywhere. It can happen from a car accident, can happen from a ski accident, from sports, from work. It doesn't matter. Very simple. Understand, diagnosing any of these injuries requires specialized imaging. Fracture, we're going to use a CT or an X-ray. All right. Herniated disc, we're going to use a MRI. How do we diagnose support ligament damage is detected by specialized X-ray procedure. Most doctors have these in their office. We're going to do flexion extension X-rays. So this is a picture of the neck. This is bending forward. This is bending back. Now look at this X-ray. This is really important. This is a open mouth bending. Now why is that important? It allows you to see the upper neck. Now you remember earlier when I said that the MRI of the neck doesn't look at the disc above C2. You know why? There is no disc above C2. So most MRI reports start at around C2. Between cervical 1 and cervical 2, there's no disc, there's ligaments. So if you have headaches, dizziness, and your MRI is clean, you really should get a motion X-ray, an open mouth X-ray. Now, the problem is most doctors are not going to have an idea to how to test that. So that's why you need to find a smart injury doctor in your area. Okay? So what we're looking for is excessive translation, forward and back motion, or excessive angulation. And we can look for that for your neck or your back. This is someone bending forward, flexing forward, and this is someone leaning back. This is the head flexion forward, this is the head in extension. This is an open mouth. These are your teeth. These are your upper jaw. So we can see those vertebrae underneath your skull. And remember, there are tons of nerves up high on your neck. Those nerves control everything in the body. So the greatest density of nerves are in the upper cervical spine. So that's why you can have visual problems. That's why you can have headaches, dizziness, ear problems from an upper neck injury or an upper neck instability. And this is a report. Once we get a measurement of the spine, we can send these x-rays out to a company called Spinal Kinetics. And this is called a CRMA report, a computerized radiographic mensuration analysis report. This is a fantastic tool, and it's just like an MRI report of your spine. It's a excessive motion test. It's a support ligament test, and that report is very helpful for the treating physician. This is what an open mouth x-ray looks like. Now notice this red line. This is one edge of the vertebrae here. This is the other edge. If you notice this top vertebrae, that's C1. There are 7 cervical vertebrae in your neck, is overhanging C2. That tells us that very simply there's damage to the support ligaments of C1, C2. And that can cause horrific headaches, dizziness, balance problems. Again, MRI was never designed to detect excessive motion. And so here's an interesting research: chronic neck pain, making the connection between capsular ligament laxity and cervical instability. So these upper cervical instabilities can mimic mild traumatic brain injuries. So if you had all the problems associated with mild traumatic brain injuries, headaches, neck pain, dizziness, memory loss, typically you need to have an upper cervical spinal stability test. So find a smart injury doctor in your area and make sure that test was done. Remember, without the right diagnosis, you don't get the right treatment. Those ligament injuries are so severe that sometimes surgery is necessary. Now, in my clinic, we have a 95% success rate in stabilizing the spine without drugs or surgery, but sometimes surgery is necessary. And those ligament injuries are so severe that it qualifies someone to do surgery. So that's how severe it is. But most of the time, if you see a good provider, they can stabilize it without surgery. Now, this is a little fun fact. If you've injured your spine at work and you see a chiropractor, your chance of surgery is 1.5%. But what if you saw your medical provider first? Well, then you have a 42.7% chance of getting surgery. So who you see first matters. Again, this is an interesting study, 2013 in spine. Bottom line, see your chiropractor first. Find a smart injury doctor in your area. And then this also gives us information on return back to play. When someone's injured, they may not be able to go back to play. Well, how do you know for contact sports? Well, it depends on how much excessive motion there is. So if there's the more ligament damage, the more movement, the more instability. Now, this talks about osteoarthritis. What's the chance of you having arthritis in the future? It's really simple. If your spine moves too much or not enough, it's going to break down faster. One more time. Too much or too little motion is causing the spine to get arthritis. Now, 3 possible spinal injuries to work up: fracture, support ligament damage, or a disc. You need to have those 3 evaluated. The most common missing link is the support ligament test. And if we injure the support ligament, what happens? It leads to chronic pain. Some of these research studies show 88% at a 10-year follow-up. Some of this research shows 44 to 90%. So those are terrible statistics if you've had a whiplash. So you need to find a smart injury doctor. And not only are these ligament injuries painful, not only are the most common cause of disability, they're expensive. The first leading cause of pain and disability is low back. The fourth leading cause is neck pain, and the sixth leading cause is headaches. That information is from the American Pain Society, the American Physical Therapy Association, the National Library of Medicine, the Mayo Clinic proceedings. The bottom line, support ligament injury is missed, it's serious, and it's progressive if you don't fix it. So, not only are they expensive, I don't want to get into the details. In my clinic, these people don't incur those costs. Why? Because we know how to diagnose them, we know how to treat them, we know how to manage them. This only gets to be excessively expensive when they're not diagnosed, they're not treated, and the acute injury goes chronic. So to avoid pain, to avoid disability, and to avoid those huge costs, get a diagnostic motion x-ray by a smart injury doctor. That will guide your treatment, your home care, your rehab, and we want to avoid this. So again, why are these costly? Why do we have chronic pain? Because the most problematic, remember that slide I showed you with the pyramid? The most common injury is not diagnosed. Think about that. Common sense, the most common cause of chronic pain and disability is a ligament injury. And that is only diagnosed by a motion study, putting your body under stress. Think about it. A lot of people feel no pain at rest, but when they load their body, when they move, they have pain. That's why you need to get an excessive motion test to get a correct diagnosis and correct treatment. And bottom line is, how can you properly treat an injury that was never diagnosed? 3 main injuries to the spine: fracture, disc, or supinal support ligament. They have different symptoms, and they're diagnosed different, and they are treated differently. So again, I constantly stress chronic pain, make sure you get an excessive motion test by a doctor in the SMART Injury Group. So I'm going to give you a little bit of an example of some of the patients I've treated in the past. Now this is a person with chronic headaches, neck pain, arm pain, and back pain. Blue line is normal, which is this curve. The yellow is them. As you can see, this is a severe misalignment. This person had horrendous pain. Guess what? MRI was negative. So the spine is far from normal. That's a huge kyphosis. Remember this number, 29. Now I'm going to let you zoom in a little bit so you can see it. So what did we do to fix this? Okay, now this type of problem could take several months to fix. I only had, I believe, 2 months or 3 months with this patient, and then they had to leave the country. But we did a tremendous correction. So one of the things we do is we do exercise. So we're going to put the neck exerciser right here, okay? So this is called the neck exerciser, and we put this right here, and we put arms going up, okay? And this is an exercise that we do, and we would focus it right at the apex. Now, we also would use an instrument, and very simple. Some people like a manual adjustment where I use my fingertips to move the bone. Some people we use an instrument that they don't like the cracking sound. They don't like the manual or the fast adjustment. So we can use an instrument, and we would put that right here. Then we also would do home traction. Home traction, we use something called a De Niro roll. And we'll talk more in detail in the next video about it, but this is what it would look like. The person would lie on their back, and they would reshape their neck. They would do this 7 days a week, 20 minutes. Now, we start out at 1 minute, and everything we do should be pain-free. Nothing should hurt, no blurry vision, no dizzy, no nauseous. But that's how we would correct the spine. Adjustments, exercise, and traction. Very simple. Now let's look at the post. Okay, go ahead and slide down, and let's see. Well, won't stop right there. Now this is the flexion. Now the red arrow indicates that the skull and the first vertebrae are locked. When you bend your head forward, those vertebrae should separate. And I'll show in a minute what that should look like. Now, right here, this is another locked vertebrae. So we target the adjustment, we target exercise, we target the de Niro on the locked vertebrae. Excessive motion occurs above that. Slide up just a little bit. Yep. Keep going. Right here. Now this is the post. If you notice, the yellow line is much closer to the blue. In fact, I think we went from 29 to about 17. Now, again, this takes time, and I believe we only worked with this patient either 2 or 3 months, but within 2 or 3 months, the spine is getting close to normal. This would be considered a very severe or very large displacement. And the person was asymptomatic, headaches are gone, numbness gone, neck pain better, back pain better, because we changed alignment. And we got that information from the x-rays, both flexion x-rays to test for excessive motion, and then also the static x-rays. This is another patient with a flexion x-ray where their head is bending forward. In fact, this is the skull. And if you notice, this is the skull right here. This is the first vertebrae or the atlas. Notice how there's space. And the previous x-ray, there was no space. That was locked. Now, this right here is excessive motion, right here. There's ligament damage. So when one area of the spine becomes locked, usually something above or below moves too much, and that's not good. So that's why the difference between general manipulation, sometimes you see that on the internet, versus targeted, very specific adjustments, very specific exercise, very specific traction, that makes the difference in results for long-term pain relief. This is an example of another misaligned. The blue line is normal, yellow is the individual patient. Look at this, the amount of distance between the yellow line and the blue. That's the pre, this is the post. Patients lined up perfectly, still not perfect, but much better. Again, adjustments, exercise, traction. The key is specific diagnosis. That means treat each person with an individual, get targeted exercises, not general. Get targeted adjustments, not general manipulation. Traction is always a very unique thing for the patient. You cannot do this at home without a doctor's supervision. Not everybody has the same treatment, so you need to get a motion x-ray, find out where the instability is, find out the degree of instability, and then you personalize treatment plan for the best results. This is another example of a kyphotic neck, and that is indicative of ligament injury. So again, the ligament injury can be from one trauma like a car crash, or what if you work 20 years with your head bent over in a shoe factory? I've had patients do that. So look at the difference. Look at this number, 17.68. Blue is normal. Yellow is the individual patient. And after adjustments, exercise, and traction, this is the post x-ray. As you can see, the blue and yellow are closer. This is a structural change. And guess what? When you are aligned, you function better. That means elimination of headaches, neck pain, arm numbness, arm weakness. The body functions better when it's aligned. Your car functions better when it's aligned. The plane that you're going to fly in on your next family vacation functions better when you're aligned. Get a motion x-ray to determine your alignment when you're static or neutral or standing still, but also you want to know at which vertebrae are stuck, which have excessive motion or spinal instability. Many people suffer for months, sometimes years after a car accident, feeling frustrated, hopeless because their treatment only manages their symptoms. Sometimes they're worse now than when they started, rather than fixing the real problem. If you've been told there's nothing wrong, but still have pain, weakness, numbness, know that you're not alone, and there's a solution. Ligament instability is one of the most common root causes of pain and disability. Addressing it directly with a targeted, motion-based treatment plan can help you finally break free from the cycle of discomfort, weakness, and disability. Healing takes time, but with the right approach, with the right diagnosis, you can regain control of your body, reduce pain, and basically get your life back. Go back to things you want to do. Now, you don't have to live with chronic pain or instability for the rest of your life. By stabilizing your spine, strengthening the supporting muscles, retraining your body's movement pattern, improving your alignment. You don't just feel better, you gain confidence in your ability to heal and repair, in your body to move, prevent future problems, and get back to living the life you want. Now, if you find value in this video, if you know someone that's suffering with chronic pain and they've had those usual tests like MRIs, CAT scan, and someone said there's nothing wrong, do me a favor. Like this video and share with others so you can learn about other types of ligament testing or excessive motion test. And do me a favor, leave me a comment and question about the excessive motion testing, because if you need help finding a doctor, I can help you with that. You can always look up Smart Injury Doctors. Smart Injury Doctors are expert in diagnosing, treating, and managing ligament injuries, particularly from trauma. Remember to subscribe to my channel if you want to learn more tips on how to eliminate pain, avoid surgery, stabilize your spine so you can live stronger longer. The next video you should watch is the whiplash injury, causes, symptoms, and corrective treatment. So if you want to see how we approach it and learn more how we treat these types of whiplash injuries of the neck and back, please go to this video next.